I'm feeling slightly discombobulated because we've got this going on behind us, and I was really horrified when I saw the photograph go up. So I'm going to be trying not to look behind me as this is going on. I should have also said, actually, I'm a learning disability nurse, and it's also very nice to see lots of people here that I know. Okay, so I think that we're here to kind of set the scene. And I think a lot of the things that we're going to say, you're going to know about. But nevertheless, it's important perhaps to remind ourselves where the help came from. Because I think that will give you some sort of background as to why it's developed as it is. So, as we said, everybody sounds like they've heard of Improving Health and Lives. And we were set up initially as a recommendation from Sir Jonathan Michael in his report, Healthcare for All. And you remember, I think, that one of the things he said was that people with learning disabilities were invisible within healthcare systems. And therefore it was very difficult to tell actually what was happening in terms of health. But one thing that we were very clear about was that people with learning disabilities were getting a poor deal, and they were experiencing health inequalities. And one of the key aims of the observatory was around how do we address health inequalities for people with learning disabilities. So actually one of our first publications was health inequalities for people with learning disabilities. And that brought together all of the research that was available about health and people with learning disabilities. And also, importantly, talked about the determinants of health inequalities. So what we're going to talk to you about today is, what do we know about how good health of people with learning disabilities, why people with learning disabilities have poorer health, and then Chris is going to talk about what we can do about it. So, in a nutshell, and again you'll know all this, how good is people's health, people with learning disabilities' health? Well, we know it's not very good. And we know it's not very good in many ways. And we know it's not very good at every age. So people will know that the confidential inquiry reported earlier this year, and the cohort of people that they were looking at, people with learning disabilities were dying a lot younger than the general population. Men were dying 13 years younger, and women were dying 20 years younger, which is something that we're still not quite clear why that is. But that's a considerable difference in time of death. So we also know that people with learning disabilities are more likely to experience physical impairments, and they're more likely to experience sensory impairments, and that these impairments are less likely to be picked up. And I think this is crucial because, of course, we know that people with learning disabilities, there are already issues with communication. And then if you start to factor in things like people not being able to see very well, or people not being able to hear very well, that has a huge impact on people's lives. We know that there are lifestyle factors. We know that people with learning disabilities are much more likely to be overweight than the general population. And indeed, they're more likely to be underweight too. And we know that there are other health risks with that. So we know that people with learning disabilities have higher rates of diabetes, and they're more likely to get constipated, and they're more likely to end up in hospital by being constipated. And this seems to be a really big issue. And how horrible would it be to be so constipated that you end up in hospital? We know that people with learning disabilities take less exercise as well. And actually, the more their impairment is, the less exercise they're likely to take. And of course, there's an increased risk of acute and chronic pain with people with learning disabilities, which is also a great shame because that's another thing which doesn't tend to get picked up very much and was very clear from the confidential inquiry as well as research. And I could go on, but these are things that you will be familiar with, so I will stop now. It's just, I think, important to remember the huge impact that these things have on people's quality of life. I still think there's this issue about people thinking health and then the rest of people's lives. And we need to think about it together, because all of those things will have a huge impact on people's quality of life and their ability to interact and do other things. So, why is it that people with learning disabilities are experiencing this poorer health? Well, we have to say here, we've rather managed to confuse the issue, because the report I showed you at the beginning, the Health Inequalities report, we write that report every year. And in the latest report, we slightly changed the way that we described the determinants of health inequalities. So actually we're describing the determinants of health inequalities in a slightly different way than you will be familiar with from the health equalities framework. But that model is still just as relevant as this one, and they say the same things. The reason that this rainbow model has been used is it shows how one thing interacts with another. But as I say, it is actually, it does say the same thing. I just needed to alert you to that. So, we know that where people live, the general conditions in which they live have an impact on their health. I've been in London, and somebody was telling me if you live on this side of the street, you're likely to die 10 years younger than if you live on that side of the street. You'll all be familiar with that sort of scenario. Okay, and so where you live, this sort of outer ring, has an impact on your access to services, access to ability to buy healthy food, the sort of education you can get, the sort of employment opportunities, type of housing that you live in. So that that outer ring has an impact on all of those other things, and that then in turn has an impact on your social and community networks. And then that in turn, where you live, who your friends are, who your relationships are, then has an impact on the choices that you are likely to make in terms of lifestyle, the choices that you're able to make in terms of lifestyle. And then finally, on this inner circle, it's about you, your age, your sex, and of course it might be also things like syndrome-specific conditions. But it's not just about that, it's about all of those other things. And we know that people with learning disabilities are very exposed to these determinants of health inequalities. We know that people with learning disabilities are more likely to be poor as a child, and in fact, families of people with learning disabilities are more likely to become poor as well. People with learning disabilities are more likely to be bullied and abused, and this has an impact on health. And they're more likely to be excluded and isolated as well. And the confidential inquiry had an interesting finding there, where it found that people with learning disabilities who had a significant other person in their life were less vulnerable to a premature death. So that's very, very significant. And of course, people with learning disabilities are also much more likely to be poor and unemployed as an adult. And all of this has an impact. Oh, and poor healthcare. I don't know why that came in last, but and of course that brings us on to the next thing. Going back to the confidential inquiry, one of the things that they found was that the most common reasons for death being assessed as premature were the delays or problems with actual diagnosis and treatment for people with learning disabilities, problems with identifying needs, and problems with providing appropriate care in response to changing needs. And there is a lack of reasonable adjustments for people with learning disabilities. And how long have we been talking about reasonable adjustments? And yet still, people don't seem to understand that very well. And that lack of reasonable adjustments had an impact on whether people were going to experience a penalty or death or not. So it's very interesting to hear Ben earlier talking about the hospital passport, which certainly could be argued as being an important reasonable adjustment for people with learning disabilities in hospital. Okay, so I'm going to hand over to Chris now, who's going to...
Is this one switched on? Can people hear me? General indifference.